Presence, ma'am. Welcome, welcome, welcome. Let's get going here. Oh, Kathy in the hall. Kathy wanted to chit chat a little bit about Appendix J's and the procedures. There she is. She's sneaking in the back. And how when referrals are made, don't go too far. Where referrals are made and need to go back to coordinated entry for re-referral or whatever. Just a way to make it easier on everybody, and that way we can close the gap for the clients. So Kathy, you are up.
Hello. How is everybody? Great, fine, wonderful?
You're not gonna talk.
I was talking to these guys.
Lydia's not paying attention to you either.
I see. Yes, Appendix J is, you guys just don't understand how important an Appendix J is to coordinated entry. We are all here to provide a service, and our service is to make sure that we take care of the client. There is no ding that appears magically whenever you upload an Appendix J. They do need to be uploaded and case noted. You can use your header in your case notes. Just simply label it Appendix J. Make a case note in case notes. It's as simple as copy and paste. Shoot that email over to Tammy at treading@unitedwayofthecv.org. Everybody is familiar with how an Appendix J works, what it's for, what it's used for.
Just get back.
There's different reasons. If you can't get a hold of the client, which is what we run into a lot, that's a reason for an Appendix J. They refuse service but not willing to sign an Appendix I. Same thing. I can't remember what all of them are. Those are the main two I've always seen. Yeah, doesn't meet qualifications. We can't verify homelessness. And I can't see it because I didn't bring my glasses. I'm at the Appendix J though. Once Tammy does receive the Appendix J, this is very important. We do coordinated entry, does a post Appendix J follow-up to get in touch with the client to make sure.
Hang on one second. It looks like I forgot to share here. Thanks for saying something, Denise. See this presentation? Yeah. Somebody nod or something. Cool. Awesome. Thank you.
But yes, we will do a follow-up call. We being coordinated entry, will do a follow-up call, post Appendix J to talk to the client, just to be sure there wasn't some type of miscommunication in several instances. If it was some type of miscommunication, be it syndrome when entering in the phone number, I'll send it back to I have sent it straight back to the agency. That way they get the referral all over again.
Earlier, Lydia and I were talking about some things, and she mentioned that they have a lot, or quite a few clients who don't have contact information. Does coordinated entry give information to clients as to where they're being referred to and those kinds of things?
Yes, we will, if we know that they have no contact information. You don't have a phone, so here's what I'm going to do. I'm going to send your referral to agency A, B, and C. Give them about 3 business days. Go up there and visit them. I don't just send them willy-nilly out of here or nothing like that. Also I try to always get an email address, because they may not have a cell phone available. Sometimes it's easier. Can I borrow your phone? There's community computers in different places, things like that. Even if they do have a cell phone that's not active, jump in on McDonald's Wi-Fi. So I always it's always a good rule of thumb to always get an email address, because you can conversate. It's just being patient on one end where they don't have a cell phone, waiting on them to check their email or whatever the case may be. Yep, definitely upload the Appendix J to client files. like I said, put the case note in, copy and paste it in the email to Tammy. That way Tammy can continue to reach out to the client. Again, after being notified of the Appendix J, Tammy will contact the client again, just to, again, be sure there was no miscommunication or something wasn't just right.
And to re-refer.
And to refer to, yes, because, you know, the clients, they're our priority. I don't have anything. Any questions?
Yes, I have a question. Can you hear me?
Yes, ma'am.
Okay. Question. I've been running into this situation a lot in the last 3 weeks. We've had an influx of people coming from other agencies, and not knowing they were coming from other agencies or whatever, they've been referred by outside sources. Like, let's say, for instance, a church may be paying for them to stay in a hotel, or another agencies that's not affiliated with us may be paying for a hotel. Maybe, like I said, I had somebody one time to age out of defects. So, you know, we asked them question. I think that's something we may have to add to our assessment form as well. Asking them, are they enrolled in other services? Come to find out, we get them, and we get the letter of homelessness or from whatever entity or agency that's paying for their hotel, and we'll go ahead and enroll them. And then when we get ready to do the 211 referral, come to find out, they're enrolled in another service with another agency. So it's like, okay, so we give them that option. Which one of us do you want to work with? Because you can't be in both at the same time. So either you're going to be with Home for Good or you're going to be with us, and, and we give them that option. And sometimes my majority of them say, well, since I'm already here and getting stuff rolling with you, I'd rather go ahead and do it with you. So, okay. So I've instructed them to go back to the agency and say, hey, let them know that you prefer to be in PATH and that you need to cancel your services with them or discharge your services with them. And I normally do a follow-up call to make sure it was done instead of just proceeding forward. And I just want to know, is there a certain procedure, or there's a certain turnaround time for that other agency to send the Appendix J? And I'm just asking because, like I said, I know we all are busy, but I've just been dealing with different agencies where I'm just waiting for the Appendix J to be sent and things, because if somebody else is paying for the hotel room, we want to keep the ball rolling just as much as possible to, get these people started or get them somewhere, because especially if it's like a church, I know they're paying for their room by the week, but they also want to know, how soon is it going to take, so they can kind of govern themselves accordingly as well. And one thing I'm trying to do with and I've been suggesting it with PATH as well, we're looking to try to build a lot of relationship with churches, because we're coming to find out they have a lot of funding and stuff when it comes to temporary housing and hotels and things like that, and which is very helpful. And so I don't want to mess up anything with that resource either. So it's kind of like, what can we do, or is there a time frame that an Appendix J needs to be sent? I don't want to come off pushy, but at the same time, I want to make sure we keep the ball rolling.
Well, Kim, okay, you're gonna have a 2 for now. For if the client makes a decision, that client has the right, and I would encourage you to have a client to go ahead and do an Appendix I, which is the client declining the referral for the other agency, and get it sent over.
Okay, now how do I go about doing that? Because like I said, with us not being in local contracts, so a lot of this is kind of Greek to me.
Well,
I knew the Appendix J.
You know what? I wasn't going to bring up the fact that PATH should be participating in the local COC implementation of HMIS. We weren't going to go there today, but yes, but if number one, the client needs to do an Appendix I, and that is not exclusive to, and it's not located in HMIS. It's uploaded to. So we can make sure that you have a copy of the form. They are on the website, but we can make sure, we can put it on as an addition to the notes that go out and the slides that go out from today's meeting, number one.
Okay.
Number two, when you're talking about the churches and paying, and absolutely, they are an absolute wonderful resource for the almighty dollar to help us to have access to temporary emergency shelter.
Mm-hmm.
But I would suggest I know there's about 5 churches now that are working on an MOU amongst them. And there's some others that we would like to bring on board, that everybody understand, guess what? If you're going to work with the client who's experiencing homelessness, you need to have a discharge plan at the time they enter your program. Meaning,
Right.
if you put them through coordinated entry, or if they come through coordinated entry, we know that we're working with a housing program while they're temporarily housed. You got to, and that way you can close that loop right there.
Right.
So we like I said, we can make sure that you get the Appendix I, because, and on the other side of that coin, I know in the last 2 weeks, there have been several cases where the client said, whoever comes through first is who I'm going to work with. Well, no, it doesn't work that way.
Yeah. Yeah,
So-
that's why I told them they needed to make a choice.
Right.
And then I also find out why, they're trying to go. And a lot of times it's because I have to look at their situation. They're in the situation, you know what I'm saying? And I know it's uncomfortable and they're needing somewhere to stay and they need help or whatever. So I try to look at it from 2 ways, but at the same time, like I said, you can't have 2 irons in the fire at one time, especially with
Right.
the housing program. So you need to be either or. And what is this agency not doing that you feel that I can do better, So, because we pretty much doing the same thing. So what is it?
Well, but then again, and I think you're absolutely right. We need to make sure that we are all making sure that the client's needs are being met.
Mhm.
And that may be working with 2 or 3 agencies at one time, but not doing the same thing.
Right.
Housing, mental health over here, medical health over here, and those kinds of things. So yeah,
Right.
we can, let's continue, but Appendix I will be added, and then Appendix J will be added to the slides that go out today, so everybody has access. If the client says, hey, Kim, I want to work with you, go ahead and take the bull by the horns, go ahead and get it sent off and done.
Okay.
And again, I'm going to still highly encourage everyone to use local implementation. But if not, you can always fax it or scan it and email it over. It'd be the easiest way, is to scan it and email it.
Please don't fax.
Okay, Kathy tells me, please
Don't
don't
fax.
fax. I'm an old fashioned, I'm sorry.
Please don't fax. Please send it to one of our emails.
Yeah.
I'll make sure that everybody has a copy of my email address, and of course, they can always do online.
Yep.
At the Home for Good website to do an online 211 intake.
Yep. for
I
clients.
get the online intakes. They come directly to me. So if you have a client that you're working with, shoot it in, and it just speeds the process up. That way, nobody's left in the dust. It's the easiest way to do it. The online has been, they don't have to talk to no extra person or anything like that.
And don't have to stay on hold.
And don't have to stay on hold. And then Tammy, as soon as it's pushed over, it's a bit of a quicker process now as far as getting on 211, moving through to coordinated entry, getting referred out to agencies.
Well, thank you.
Thanks.
Agency updates. Thank you for the Veterans Day reminder. We will be closed next Thursday. And I'm sure a lot of agencies will. So just to remember that. Any agency updates, anything going on? I guess I hit. Yeah, that says you.
Can I ask a question, Ms. Pat?
Yes.
Did you say that there was a timeline, like when we get the referrals to get the VSPAT back into you?
No, there's a timeline. Okay, and I will, just for grins and giggles, we'll go ahead and attach the entire policy and procedure for coordinated entry, but we'll do also separately the flow that has the date. There's a 3-day window between the time the referral is sent to the provider for the provider to start attempting to make contact with that client. That's what I was referring to. And if after 3 attempts in 7 days, and we're always talking business days, obviously, that client
Okay.
has not been able to be reached, then you can close out that referral. But if it's
Okay.
not documented, for instance, Pat got her referral was sent over to Denise today. Well, Denise documents next Tuesday that she called Wednesday, Thursday, and Friday of this week. That doesn't count. If you didn't document it on that day, it doesn't count. It counts for the day you put it in. So again, you can't say, I called on this date. You can't, on the 24th, you can't say, I called on the 20th, the 21st, and the 22nd. Yeah, right, you did. That's called, fudging numbers. So, did that answer your question, Laura?
Yes, it did.
Cool.
Thank you.
Agency updates. Joe, go. Miss Liz.
Hi, I'm Liz with the Homeless Resource Network, and my agency announcement is we are discontinuing our homeless services. Our last day during homeless services will be the end of December. We will be continuing our services for people living with HIV and AIDS, and we will continue our indigent ID. So someone who needs help with a Georgia state ID and is indigent, we do that on Tuesdays, and we will continue that. That's my announcement.
Don't go any further. Just make sure there's no questions. Any questions for Liz? That was too easy. On Thursday, November the 18th, right here at the First Presbyterian Church, boat riders will be here in town again to assist folks with getting ID, birth certificates, and/or social security cards. I will be getting a flyer together sometime this week to get out to everybody. It will be posted in our newsletter this week as well. We'll be posting it on our Facebook and website and all of those other portals and outlets. Someone have a question? But so that's, again, that will be the third Thursday. And it's our hope going forward that the third Thursday of every month from 5 to 7, that they'll be here at this location. We're looking for 3 to 4 other locations throughout the community to do regular ID or vital records events. Some we've talked about Victory Mission over in South Columbus. I know Safe House Ministries has talked with Pam, and I think she had arranged to be there at some point. Pam is with Vote Riders, so keep your eyes and your ears peeled for that. Another way for our folks to be able to get those vital records, and it'd be free of charge to them, free of charge to the community. They are able to provide transportation to the locations, whether it be the Social Security office, the DMV, or whatever. So that's really, really cool. I really have nothing else happening. Anybody else? Any breaking news? Anybody? All right, next Tuesday, VA is having a VA benefits workshop at their location in the old Cross Country Plaza office space back there. Data quality reports for the last month are due on November the 12th. And our next meeting will be December the 7th. Same bat time, same bat channel. We'll give it about 45 seconds. If nobody has anything, we can wrap this joker up. There will be, yes, ma'am. The question, for those of you who didn't hear it, Nashada was asking Liz if they're still enrolling, and for Outdoors No More, which is their housing program through the city, I understand, right, Liz? They're still currently enrolling and helping folks to access housing. Yes, Charles, you got a question? Okay. Charles joined the Home for Good family last Monday, right? So Charles is now with Home for Good. So we're glad to have him. And there was something else I was going to say, and now it escapes me.
Well, Pat,
Yes, sir, Mr. Louis.
yeah, I just wanted to tell you one thing that's going on with this Georgia rental assistance. It's got worse. I've been trying to work with some landlords to, go ahead and apply, even though it's first come, first serve. But as a landlord myself, I have had a particular tenant this past week that we had already sent in everything, but it's so hard to verify from them that they have all the record, And so anyhow, they referred me. They said, "What can are you in?" I told them Muskogee. So Lord have mercy, here they refer me to Liz, and then Liz referred me to, let's see, Access to Independence.
Uh-huh.
Yes, and then so I've contacted them. Anyhow, this particular client I was working with, it disappeared from a link to my company. And so, of course, the people locally can't do anything or tell you anything. Fact is, I forgot the guy's name, but he's already overwhelmed down there because there's so many questions. So today it's about once a week now, I'm talking to him up in Atlanta, and they're having some kind of glitches in the computer work. But I was able to get it straightened out. But my hope for the future, though, and I'm going to go meet this guy over there and see what we could do, with landlords. Is he really going to be able to do something? But all I know he is, though, is a government contractor.
Well, I can say this, Louis, and very frankly, we did one application for Georgia rental assistance, and that was enough for us. It was, I say, people
Well,
nodding.
you
It was
see
too
what we're
much.
going through.
It was too much. So luckily, when the eviction moratorium was lifted, we have prevention dollars that are, and so if you can steer the landlords or the clients, they do the same thing. They do our online intake, and we'll again put a tag on today's notes from today's meeting. Do that and put at the bottom prevention. That gets the ball rolling right away. That's where Kathy's over there. Her eyes are gleaming because that gets her all excited because that starts that ball rolling. And the first step we do with the prevention is to make sure that they're not currently under Georgia rental assistance, because two pots coming from the same, two bowls coming from the same pot, so we can't dip in there. That's the first step, but we can make that happen.
Okay, me as a landlord and a tenant, I've got a new one that qualifies, it looks like. I mean, new to the problem. Who do I contact?
I'll send you the link for the online intake that the client needs to do, and we can get the ball rolling. We'll make it all happen. Yep.
That's the best news I've had all day.
Yep. Now, Liz, you were asking a question?
So when people call 211, do they get that information from too?
Prevention, yes.
Okay.
Yes, prevention.
So
Yeah.
how do they, so they have to say the word prevention?
That's why we steer everyone to the online. Honestly,
So
it's
the
easier.
link that you're given, so when people contact us, we can give them that link?
Absolutely. Prevention at the bottom line.
Okay.
Yep.
So it's the coordinated, they do the regular coordinated.
Yep. And just put prevention on the bottom line. Yes. Yep. Yep. Anything else? All right, so for today's meeting, we need to have a copy of entry policies and procedures. We'll have a separate sheet, so you don't have to go through the whole thing, for your Appendix I, which is your client referral declination, Appendix J, which is the agency declining the referral, the workflow that has those dates on there for you, Laura, and then the link to the online intake, which again, rather than, like Kathy did an experiment, had some folks do an experiment for me last week. The average hold time was 7 minutes. Sometimes it's up to 25 minutes to get on to 211. It's 45 seconds average to do the online intake. And it can be turned around within that same day. So it's just a no-brainer. With that, we're going to adjourn. Bye, Mr. Louis. I'll send you that link.
Thank you.
Bye.
Thank you. Bye.